There's also a time when cold and flu cases pop up as family and friends gather in close quarters. And though the COVID-19 pandemic is behind us, COVID is likely to stay with us for years to come. Joining us with some tips to stay healthy is Dr. Andrew Thompson, an infectious disease specialist with St. Luke's here in Duluth. Welcome, Doctor. Thanks for being here with us tonight. Are vaccinations something, Doctor, we should be having annually?
Yes, we should. For a while now, flu shots have been recommended for all people annually. And this year, there's also COVID booster is recommended for all. And RSV vaccine is recommended for some groups of people.
What is RSV?
RSV is a virus, and it's particularly bad for the very young, for infants, and for older individuals, and those who might have immune problems. Mm-hmm. But it can cause a bad pneumonia.
Mm-hmm. What are you expecting this year in terms of respiratory illnesses in our area?
I never like to predict.
Do it anyway.
We can reliably expect that there will be some influenza. We're already seeing a few cases of influenza in Minnesota, but it's hard to know when it will peak and when activity will be particularly bad. Last year was an early season. Usually we see a lot of activity in December, January, February of influenza. COVID, we're seeing seasonal trends, and so we expect as we're indoors more, breathing the same air, that there will be more COVID cases as well. And RSV is very predictably a winter virus. So we're concerned about RSV starting now into the middle of winter.
Are there any shortages of vaccines, Doctor, that we should be concerned about?
No shortages. No shortages
That's
of
good
vaccines
news,
this year. So I encourage everybody to go get one.
Mm-hmm.
So we're heading into a holiday week. Is it too late for people to get vaccines now that will help them at that family gathering for Thanksgiving?
It really is. It's too late to get a vaccine now to protect you during Thanksgiving, but it would be a great time to get one to protect you during gatherings in December. Family gatherings are on Christmas and the New Year. You want to get a vaccine about 2 weeks before you might be exposed to something for it to be effective.
Mm-hmm. You mentioned that COVID vaccines are recommended for everyone. The people who had the initial sequence and or have had COVID, do they still have any immunity from COVID, or has it really morphed to the point where that doesn't really protect you anymore?
That's a somewhat complicated question. They have some protection, but COVID has mutated so quickly that the virus that's circulating now is different than the original strain. So our updated booster vaccine, the current one that's available, is targeted toward what's circulating now, what's in our community now, which is very different from the initial strain.
When you say different, is it more deadly or?
No, it's just changed a few of its proteins such that our immune system doesn't recognize it as well from that initial exposure. So it's not more serious, but you might have less protection based on your past vaccine or your past infection.
Mm-hmm. Mm-hmm. So as a physician and in the medical community, is COVID still a greater concern than the regular seasonal flu, or has it morphed to the point where it's pretty much the same?
That's a good question. They're both of significant concern to me. I'm not going to rank them in order. But COVID it's still very significant. There's still a lot of deaths due to COVID. There are hospitalizations due to COVID. It certainly hasn't gone away. So I still take it very seriously.
Are large numbers of people getting vaccinated?
No, it's actually somewhat disappointing.
Really?
With our recent booster vaccine, a relatively small percentage of Americans are getting vaccinated. And my hope is for those who are at higher risk, those over 60 or 65, or those who have immune compromising conditions,
Okay.
if they get it.
Dr. Andrew Thompson, thank you very kindly. Appreciate you being with us tonight.
Happy to be here.
Thank you.